Hello everyone, thank you very much to the organisers for this opportunity to present at the workshop. My talk will focus on the funding side of this debate and a perspective from the Lush Prize. So briefly, what I'll cover, an overview of the Lush Prize itself, how a lack of funding of new approach methodologies is impeding scientific progress, how institutionalised bias favours animal research, the responsibilities of funding bodies to advance NAMs through improving funding and transparency, and concluding with some positive change and current efforts to overcome this barrier. So the Lush Prize itself is a global fund to support initiatives to end or replace animal testing. Since its launch in 2012, it has provided 2.8 million euros in funding across 5 categories, which are science, training, lobbying, public awareness, and young researchers. It was launched to meet an urgent need to fund replacement of animal tests with more scientifically valid, human relevant alternatives, or NAMs as we call them now. And within the 3R's broader definition, the prize focus has always been on the 1R, as we call it, which is replacement of animal use. So moving on to how a lack of funding of NAMs is impeding scientific progress. I've just summarised 2 main areas of safety testing in this table and the problem and consequences, given the rising concerns that current testing strategies aren't fit for purpose. So if we look at industrial chemicals, there is an issue with animal models that are used being outpaced by the sheer volume of new chemicals emerging. And despite large-scale testing programs and the testing approaches available, there's still a big unknown on the total number of industrial chemicals worldwide. And not only that, the problem that thousands of substances are still considered to have insufficient or unknown safety data. If we switch to pharmaceuticals, it's now quite a well-known statistic that 86 to 90% of new drug candidates fail somewhere within the clinical trial phase after being considered successful in preclinical tests, which are largely based on animal studies. There are in vitro studies too, but it is largely based on animal model testing. And so from there, the consequence is that many diseases still lack effective treatments, and there is a problem with attrition in pharmaceutical development, with ever-rising costs not being matched by the new products emerging. And it also has raised the issue of how many potential new treatments are overlooked due to false positives in animals. So the underfunding of NAMs to date could be perceived as perhaps a twofold issue, with, of course, direct lack of funding or expiry of funding, which prevents NAMs entering the validation and approval process. There's also an indirect consequence where the majority funding continues to be devoted to animal models, which lack human relevance. And a statistic I've quoted here from a paper that was put together by the European Coalition to End Animal Experiments a few years ago on the amount of EU member state budget that is devoted to 3R's research is very, very low. So member states were found to devote just between 0 and 0.036% of their annual budget, which totaled in 2013 just 18.7 million euros. That was provided by only 7 countries from all member states. So it's very, very low, very poor rate of funding. And so on the right, I've just put a diagram as I perceive it on a turnaround in the thinking that's needed. So a common argument is that NAMs can't or shouldn't be funded because they're not whole animals and they're not whole living systems. But we need to turn around the thinking on that, because NAMs must be funded as they provide human relevant, more mechanistic information which can't be studied in animals. So it's looking what NAMs do provide to promote funding. And so moving on to how institutionalised bias favours animal research. Some further estimates and facts and figures on funding. So the global investment in biomed research per year is estimated in the region of £100 billion. There are no exact figures on how much of that is devoted to animal research, but we know it's a large proportion. Another statistic, in the UK, for example, the research and development spend in 2017 was £34.8 billion. Of this, we know 40% was for basic research, which does use a greater number of animals than any other category. Another statistic in the US, for example, the National Institute of Neurological Disorders and Stroke have quoted that 70% of their funded projects involve animals. Stroke is one of the major disease areas of concern, with a lack of treatments and decades of very, very poor predictivity in animal models, yet they're still used on a very large scale. And as I've said, there is a lack of transparency on exact funds allocated to animal research worldwide, which is why so many best estimates have been made. And going on to this diagram I've put together as a representation of the cycle of funding and research within academia that is devoted to animal models. Some of the information I've included in here comes from testimonies from researchers who have applied to the Lush Prize for funding, and also from statements within summaries of animal animal project applications. So you can see there is a large-scale cycle of use of animal strains and breeds from securely funded sources. This is the type of information we see in animal project summaries. And the types of justification are that they're well-established models, well-published. We use species X as they're considered the gold standard. Our choice of animal is based on existing literature, previous studies, etc., etc. So there becomes a repeat cycle of convention and use of animals through secure funding streams, secure academic streams. And from there, this was termed by a paper a few years ago as lock-in of use of animal models. And it might be seen that lock-in of their use is mirrored by lock-in of funding sources, particularly within academia. And what we must be mindful of as well is that animal research is an industry like many others, and that's very important. So something else that's very important with reference to the EU directive on the protection of animals for scientific purposes, there is a clause in there which allows for retrospective assessment of animal projects. This gives power to the member states to decide if a project using animals should be retrospectively assessed. And it can check, perhaps most critically, whether the objectives of the project were achieved, the harm inflicted on the animals, the number and species of animals used, and the severity of the procedures, which within the directive are classified as mild, moderate, severe, or non-recovery. And within that, any elements that may contribute to the further implementation of the 3 Rs. So there are scientific validity as well as animal welfare intentions with retrospective assessment. All projects involving non-human primates and any projects classified as severe, i.e. causing severe harm, must undergo retrospective assessment. Now that sounds a fairly robust clause, but in reality, relatively few projects are retrospectively assessed. So for example, in the UK, for the first 6 months of 2020, from 235 animal research applications, only 43 were earmarked for retrospective assessment. So that's just 18%. From there, within that statistic, of 11 projects that related to COVID-19 or coronavirus, only 1 was marked for retrospective assessment, which used many different species of animals. So these statistics are quite useful. Moving on, just a few further points I have summarised on the use of the reliance on animal models. There is a growing concern of convention outweighing science. As you saw earlier, the cycle of conventional use of animal models. Requests to validate NAMs in animals is a major hurdle, particularly within the peer review and publication process. We hear often how new models are developed, and when they're proposed in research grant applications or publications, they're asked to go back and validate, so to speak, in animals, which is a stumbling block. There's a high concern of overstatement of benefits and a misperception that NAMs can only at best complement or reduce use of animal models, but can't replace them. And down the right-hand side, you'll see there some statements and testimonies that we've received in nominations for prize funding, also presentations and other work on the issue of animal research versus NAMs. So coming on to the responsibilities of funding bodies to advance NAMs and improve funding and transparency. So I've put here together a diagram on, we have had recent discussions with government and regulatory bodies to talk about lack of funding. And there is a concern that this has been highlighted that it's not necessarily considered an issue. So perhaps instead of lack of funding, the argument is that barriers to approval might be that there are improvements needed. The models, the NAMS models aren't good enough, essentially, that they need to be improved in performance and optimized and improved applicability and relevance. And of course, that's true. Models do need ongoing development all the time, but that requires funding. So it does tend to come back to a lack of funding on a fundamental basis. Also, what's important to note is that greater transparency is needed on the gaps that require filling, and that requires going back to the regulators and the funders to ask what's missing and what's needed, and starting from the right approach and securing funding from there. So to recap the disadvantage of animal models, it could be perceived that they eventually reach a dead end in animal models, because despite large-scale modification to humanize them, genetic modification is very common. It accounts for half of all animal procedures, and also surgical and chemical modification. There's still competition with the underlying animal biology, so it can be seen that reaches a dead end. Whereas the advantage of NAMs is that they can be continually improved and optimized. They're much more targeted, they're much more mechanistic, and so that leads to opportunities in further training, development, empowerment, support, and uptake. And it's an important point to make that it's not just animal research that is in use. NAMs are being used out there, just not enough. So they are available, and the argument would be to try them. Again, with infinite business opportunities for research and scale up and outsourcing to ultimately achieve what's needed, which is greater human relevance. And so an appropriate argument might be to say that rather than increase funding, and of course increases in funding are always needed, but we could perhaps call this a diversion of funds from animal models to NAMs. It may be perceived as a more pragmatic approach to divert funds from animal models to NAMs that are seen as successful. This requires government action to achieve benefits for all, and business opportunities, jobs, improved training and support, and infrastructure. And rather critically, especially with relevance to early career scientists, to time it right and to get young researchers on the NAMs roadmap within their career. Get NAMs methods in the hands of researchers from the early basic research stages to introduce them, increase confidence, so that by the time the regulatory phase is reached, there's greater acceptance and greater confidence in the methods, and to increase the new generation knowledge base in NAMs and achieve the scientific transition that's needed. On an actual cost saving, the deployment of NAMs could be seen as ultimately saving money, because on a test per test basis, there is up to 90% cost saving when you look at some of the comparisons of test costs. And so I'm coming to the end for positive change, because it's good to end on positives. There are good things happening. We must remember that. Current efforts to overcome the barriers. So from the perspective of the Lush Prize specifically, early career scientists, we're seeing an ever-increasing demand, not just early career, all nominations, but in particular for young researchers, we're seeing a 15% increase in applications year on year. Some very exciting initiatives in areas where perhaps gaining support is difficult or refused, for example, in Asia or South America. Greater recognition and acceptance of work in NAMs and breaking new international ground. So it's fantastic evidence to see. The wider picture, and some of these you've already heard about, the US Environmental Protection Agency has announced it intends to work towards ending all mammalian study testing by 2035 and has injected funding there. The US Food and Drug Administration has undertaken a large-scale collaboration with industry to test organ-on-a-chip technologies. And the Netherlands government has started a large-scale collaboration, its transition program for innovation. As well as that, it's important to acknowledge ongoing work by agencies such as ICVAM and resources provided on an ongoing basis by ECVAM, and numerous roadmaps to advance progress in new approach methodologies. And some final positive notes: there's an exponential growth in vitro and in silico technology markets, and that must be maximised to good use. And NAMs are out there and being used, and try them is the message for the scientific community. I've put this picture in as a final positive note because it's a common sight at conferences. NAMS is a very popular topic, and sessions that are devoted to alternatives or NAMS in any way are very popular and usually oversubscribed, and people want NAMS, and this is good to see. So coming to the end, some final testimonies, again from the Lush Prize, on how funding has achieved greater recognition of work in alternatives. And some conclusions and take-home messages. Encouraging progress is underway. NAMs are being used, but not enough. It's still a drop in the ocean compared to ongoing global funding of animal use. So whole-scale government action is needed, and this can be achieved by political lobbying in line with scientific innovation that is happening rapidly. There are infinite business opportunities, and a call to action to divert funding is important to ultimately save money and improve research. And a call out to young researchers specifically, I've put there, don't ask, don't get. Although you may get rejected, please vocalise your interest in NAMS research and show your interest to potential funders and sponsors. And we've seen a real sea change in the last decade, and optimistically, we see the tide turning in the next 10 years. And I've just summarised the turnaround again in thinking there that's needed. So with that, I'd like to say thank you very much for your attention.